Start the timer now. Good afternoon, everybody. It's a pleasure to be here. I'll save all the niceties. No time for that. I do want to mention a disclaimer. The work I'm going to share with you is supported by the U.S. Department of Health and Human Services Centers for Medicare and Medicaid Services. And while I'm very grateful for that support, nothing I say today should be construed as the opinion of that agency. Please don't hold them responsible for my ignorance. I'm going to talk about CommunityRx, which is a program that includes two components: MAPSCore, Meaningful, Active, Productive Science in Service to Community. It's a youth employment program. And HealtheRx, which is a technology that connects electronic medical record platforms in safety net clinics and emergency departments to the data that youth from MAPSCore collect. So I'm going to quickly tell you that story. But first, let me start with this image. So this is from the New Yorker, and it shows some cavemen authorities pushing a poor, unsuspecting caveman off a cliff. And what it says is it's the only treatment plan, it's the only treatment option his current health plan offers, or something. I don't know. Brenna's head is right where. Brenna, can you read it?
Option he has under his current health
plan.
Thank
you. Very good. Nicely done. So I'm a physician taking care of patients on Chicago South Side. We have a terrific diversity of people on Chicago South Side, but many people, about half the population served by the University of Chicago Medicine, live at or below 200% of the federal poverty level. And this is a fact that most cities can relate to. Poverty, of course, is a reality of our cities. So in our cities, and I didn't say next, but we have a problem. Physicians are good at diagnosing disease, writing prescriptions for medications, and then we know the vast majority of what our patients need to get well, stay healthy, manage disease are not the diagnosis and not the medicine. It's everything else. It's fitness, it's exercise, it's fresh fruits and vegetables, it's social support, it's mental health, it's oral health. And it is a moral distress for those sad caveman doctors to say to a patient, you have diabetes and here's your prescription for insulin, and then goodbye, because we know we're throwing patients off the cliff. And this doesn't just happen in Chicago, but really in every city. So that crevasse is a crevasse of ignorance about the assets of our cities that this caveman patient could be making use of if we just knew where they were. What if our cities had, Amazon-type handle on the inventory of programs and services we have available in our city, even in the poorest communities, to connect this patient to the things he needs to do to manage with his diabetes? And guess what? What happens if we had that information and we were regularly referring patients to local businesses and organizations for the business of taking care of their health? We would also be supporting the local economy. So this is the idea of CommunityRx, and it started with MAPSCore 2009. We're employing youth. We've employed about 200 youth over the last 5 years whose job it is to map every single asset on every block of every street now of 75 square miles of the south side of Chicago and keep this information continuously updated. The youth know that the data they collect are connecting grandma, let's say, to the resources she needs in the community to be healthy. They're not just doing a menial task. They're generating data people can use and that are going to make their communities more vital. So we have MAPSCore going next, and this is the progress that our youth have made. 23 communities, 11 zip codes, 10,000 assets mapped, places serving the public. And these are every place. We didn't decide which place is healthy or not. Our partners with the Local Initiative Support Corporation and After School Matters told us everything is an asset until proven otherwise. So liquor stores are an asset. Maybe you can get a banana there. Maybe you can have a nice conversation, okay? This is the life cycle. So youth map all the businesses and organizations in the neighborhood. A cadre of people trained as community health information specialists call every one of those 10,000 places. They're now at about 3,000 and get detailed knowledge about the programs and services being offered. These data are shared publicly, and they are connected now to 3 electronic medical record platforms serving 16 different sites on the south side of Chicago as the demonstration, so patients get a prescription for the programs and services in their community they can use to be healthy, in addition to taking their medicine for diabetes, let's say. One last piece I want to share with you is that the data generated from this system are being fed back to the community-based service providers. So the YMCA can see how many people we've referred for what conditions from which zip codes, and they can also see where we needed to refer people but couldn't find any resources in the community. That becomes a business opportunity for the YMCA, or maybe for a small business owner who can do pest control, which is important for asthma management. That's what I mean by getting healthy is also good for the economy. And I just wanted to mention, since I know we're speaking to a global audience, sometimes the success of a program can depend or can be measured by its ability to scale. It turns out that Dublin, Ireland, really resonated with the work that we were doing. And this is the one other place so far where MAPSCore has been replicated. A team from Dublin came to Chicago. They wanted to learn what we were doing, and I said, okay, you're going to have to come and map a community with us. They mapped Fuller Park, a community that was predominantly Irish, now predominantly African American, and they brought the program back to Dublin, Ireland, to a community called the Liberties, where the Guinness factory is, and where youth are helping to change the face of their community with asset mapping. Thank you very much.